4 weeks after the state changed the way 1.6 million North Carolinians receive Medicaid benefits, some small health care businesses are still waiting to get paid. Nate Morabito discovered delays have some of you waiting on thousands of dollars, and the fear is if the money doesn't come soon, their patients will be the ones to lose out. Nate's asking, where's the money?
After years of preparation, the state of North Carolina handed over control of its Medicaid program to 5 private companies on July 1st. But the rollout of Medicaid Managed Care is stumbling out of the gate.
This is one of our occupational therapy gyms.
Rebecca Rowe's South Charlotte occupational and speech therapy practice helps children of all ages.
From developmental delay to autism to speech and language needs.
About 1 out of every 4 of those kids is on Medicaid.
We are in the hole for $9,000.
A program that switched to a new managed care approach nearly a month ago.
Now it's 4 weeks later, and many of us have not been paid a single penny.
A change Rowe says is leaving her and other business owners waiting on the reimbursement of dozens of pending claims for services already provided.
Unfortunately, I do know personally business owners who are not able to pay their staff this month. I can't think of another business where you don't get paid for an entire month.
Instead of the state running the Medicaid program, 5 companies are now in charge.
We're drastically transforming the way services are provided and the way that they're reimbursed and paid for.
The North Carolina Medical Society is a partner with one of those companies.
We're certainly experiencing a lot of challenges.
Sue Ann Forrest says the organization is also acting as a link between all 5 companies and patients and healthcare providers.
It's our job at the Medical Society to be a voice for them and try to problem solve so that they don't have to stay on the phone with the companies or the plans or the department.
Forrest told us the Medical Society is hearing concerns on a daily basis, including transportation and access issues. But she says all 5 companies have shown a commitment to improve.
They really want to hear from us and try to fix it as soon as possible.
That's the most difficult and frustrating part, is that we have no end in sight.
Rowe, however, says a resolution hasn't reached her business yet. A practice that already relied on federal relief to survive the early days of the pandemic.
These things should have been figured out before July 1, 2021.
One that's now facing an uncertain future again, this time unrelated to COVID-19.
If we cannot get paid in our claims processed by these 5 companies, we can't continue to see these children. And it hurts families, it hurts children.
The North Carolina Healthcare Association told us while other states experienced some reimbursement and access problems when they transitioned to the managed care format, it's still too early to tell if there are any significant concerns or trends here in North Carolina. But the association told us it is actively monitoring the claims payment process. Nate Morabito, WCNC Charlotte.
Meantime, the North Carolina Department of Health and Human Services is telling us it's committed to making sure health providers get paid, and it's working behind the scenes to fix that problem.